Welcome to the Sudanese Orthopedic Surgeons Association. SOSA presents the Biomechanics webinar.
زي ما قلنا ممكن يكون الخط قطع في الفترة اللي فاتت الناس ما فاهمة. Blades function قلنا decided by the surgeon. Blade ممكن to act as a compression, ممكن to act as a neutralization method, ممكن to act as buttress anti-gliding, ممكن to function as a bridging, ممكن to function as a tension band, برضه ممكن tension as reduction blade زي ما مستخدمة في البروكسيمال tibia branch. طيب نمسك واحدة واحدة. اوكي compression blade. الفانكشن بتاعت الكمبريشن بليد انه compressing together the main fragment of a single plane fracture result in absolute stability. That is mean primary bone healing, and that is mean the prerequisite of primary bone healing, which is the complete abolition of the motion between the two fracture fragments. So interfragmentary compression in the single plane, that is mean the diaphyseal fracture, can be achieved by multiple methods, as Mr. Bashendi said, which is dynamic compression blade family, which lag screw, and lag screw, as we said, it is need protection. But how to achieve compression function with dynamic compression blade? Okay, the first of all, we need anatomical reduction. Okay, if the anatomical reduction is gained manually, that is good. If not, we need the external compression device. Okay, after that, we put the screw in the neutral method, in the neutral mode. Then we put the other screw in the eccentric method, and we start the tightening. While we tighten, the screw is slide over the slope of the compression hole, okay, and move this fragment of bone to each the other fragment, and that leads to compression of the two fragments to each other and prevent the movement and motion between two fragments, decrease the strain, lead to primary bone healing. Okay, but in some area, this lead to compression on the near cortex and gapping of the lateral cortex, and this is avoided by bending of the blade few millimeter over the exact fracture site. Okay, this lead to even distribution of the compression force to proximal cortex and to the par cortex. Okay, lead to complete compression throughout the fracture site and throughout the cortex thickness. Okay, as we see here. Okay, the top left, this lead to compression to the near cortex and gapping of the far cortex, avoid by just bending of the blade over the fracture site a few millimeters with tightening of the screw, compression and flattening of the bending lead to even distribution and even compression throughout the fracture. طيب نمشي other function of the blade, which is neutralization blade. من اسمها هي neutralize something. Okay, الفكرة حقت neutralization أو اسمها الثاني protection blade، إنه يأشيف primary interfragmentary compression by lag screw. Okay, primary compression by lag screw by design or by technique. At the end, we have a lag screw need to be achieved with it interfragmentary compression. Okay, but this lag screw and this is interfragmentary compression exposed to very high torsional area, very high torsional force, axial, rotation, bending, and deforming force. So to protect this lag screw and to protect disruptive force, so we need to put a blade. So the force transmitted from the screw plate is spanning the area of the lag screw and transmit to the distal part of the screw and plate. Okay, so this lead to protection of our compression with lag screw. Now, this is commonly used in the distal fibula and it can be used at any site with short oblique fracture. Okay, neutralization blade so far clear. طيب بعد ذاك عندنا the third function which is the buttressing anti-gliding. الفكره فيها انه الشورت oblique fracture or الميتافيزيال fracture الفيرتيكالي oriented fracture دائما بيحصل لهم tend to be short and displaced under the axial load. To prevent this, we need like some to press this fragment and return it backward to the place. Okay, and this is some function is called buttressing blade. And what is the difference between buttressing and anti-gliding blade? It's the same function and it is the same method of blade that act with. But when we use this function in the diaphyseal area, we call it anti-gliding blade, and when we use it in metaphyseal area, very articular, we call it buttressed blade. تمام؟ الفكره انك انت تسكرو distal to the fracture site and to tighten the screw, and this is reduce the fracture, the proximal fragment backward to its normal position, and no need for screw in this fragment. Also, with axial load, prevent the shortening and prevent displacement. Okay? وزي ما بنشوفها كثير احنا الناس في الولايات يقول لك الركائز اللي بيسووها في الحوش لما تكون الحيطه طويله. This is the Petrus effect and this is the Petrus method. In the orthopedic we use it as a Petrus blade. Okay, both neutralize the vertical shear force during axial load, and in practical speak, we prevent the sliding or shortening of the fracture fragment. The most important function, which is stretching and spanning blade, which is very important. Before we go deep in such, we have many concepts should be known. Okay, it's used in community diaphyseal fracture or community diaphyseal fracture. Okay, the blade is applied only to the main fragment and spanning the community fragmented area. Okay, there is no screw in the fragmented community area. Okay, we need relative stability, so we need functional reduction. We need to just maintain length, alignment, and rotation. And we should preserve the biology. Okay, so most of the bridging blade done in Miri technique. Okay, so we can do in open technique, but the preservation of the we lose the preservation of the biology, take our benefit of the preservation of the biology. So most of them should be done in minimally invasive technique to preserve the fracture hematoma, to prevent the detachment of the fragment from the soft tissue, and to distortion of the blood supply and increase non-union. Okay, now this area is healed by secondary intention or by callus formation, no interfragmentary compression, and the strain distributed throughout the fragmented area. Okay, the principle of bridging blade. Number one, you should know about blade span ratio. Okay, the blade span ratio should be 3 to 4 times the fracture length. Okay, the length of the blade should be 3 to 4 times the fracture length. For example, if the fracture length equal to 3 holes in the blade, so the length of the blade should be 9 to 12. With الكلام ده with respect to the number of cortices that need to be purchased according to the anatomical area. إذا أنا مستخدمها في القيمة الكلام ده يكون with respect لأنه أنا داير 10 cortices above and 10 cortices below. إذا مستخدمها في القيمة أو في الأبر من محتاج ل 8 to 6 cortices above and 8 to 6 cortices below. النقطة دي وضحت يا أخوانا؟ so far clear؟ Okay.
Understood.
Number two, the principle of breathing blade, we have a blade screw density. Okay, blade screw density. This is the minimum number of screws that is needed to make your stability is your fixation stable without disruption of other principle. So avoid the filling of all holes, avoid of doing minimal screw above and below. So use the blade screw density going from 2.5 of the number of holes in the blade. Okay. ليه الكلام ده يا اخوانا؟ لانه من حاجه اسمها بوستاج ستان افكت، اللي هي الدمغه بتاعت البوسطه. لو ملاحظين لها هي مجدده بالاخرام في الجهات الاربعه مخرمه. الكلام ده ما حصل، ده عشان بعدين لما تسهل، لما تيجي تقلع بيسهل عليك انك تقلع توصيها في الحته الثانيه. البوستاج ستان افكت بيحصل لك اذا عملت كل الهول معناه انت خرمت العظم في اخرام قريبه لبعض، بيحصل لك بولينج اوت البلاد، يحصل لك shearing force ممكن العظم يتكسر لك النص. And this is one of the cause of failure of the blade if not properly applied the screw, the blade screw density. Okay. So far clear? في أي سؤال في البريدنج قبل ما نمشي لقدام؟ Or we use a breathing method, okay, or we use breathing technique. The fourth step of the fourth principle, avoid mixing of the concept and mixing of the principle in the breathing blade. ما تشوف لك فراغمنت طاري تقول والله ان نلمها بانترفراجمنتال سكرو. اوكي كده انت mix the principle and you invite the failure of the blade and you invite the failure of the biology. You may end with the metal failure and you may end in non-union. طيب what we all about the breathing blade. طيب tension band blade نقول ما قاعد نستخدمها الان في مدرجة is preserved for nailing more than plating، لكن ممكن مرات you may need it in the pediatric patient, okay, with open phases above and below, not amenable to elastic nail, not amenable for nailing, intramedullary nailing. So you can use it, you can plate it. So apply the principle of tension banding if the fracture is transverse, no comminution to the medial side, or no comminution in the fulcrum or compression side. As the function, the idea is to زي الفانكشن بان، زي التنشن بان. تنشن بان تكنيك هي نفس التكنيك اللي يستخدم في التنشن بان. التنشن بان هي عباره عن فانكشن، تمام. I'm not a device. ممكن I can gain the tension band effect is blade and I can gain it with K-wire and band. Okay. فالفكره هنا compare التنسايل فورس للكمبريشن فورس، عشان كده نحن نحطها في الديستراكتنج اريا اللي هي في التنشن اريا اوف ذا تنشن and compress the fracture, compare transform this function to transform this tension function to compression function. Okay. The most famous example is the femur shaft. Okay. Not amenable in the comminuted or fragmentary medial wall or fragmentary fulcrum. Okay, principle of blade fixation mentioned by Mr. Beshendi is our now here. Okay, by the end of this lecture, okay, we take home message. The function is more important than the type of the blade. Compression blade promote primary healing, or breathing blade promote secondary bone healing and callus formation. Locking blade act as internal external fixator and provide angular stability. And blade selection should be based on the fracture pattern, bone quality, and biological consideration. Any question? So far clear?
Thank you very much, Dr. Huzaifa.
تسلم يا زعيم.